Hello and welcome to Cannamantv. My name is Connor McLeod, and in this exciting episode I speak with Consultant Psychiatrist Dr. Rebecca Moore. With over 20 years experience, Dr. Moore is a Consultant Psychiatrist for the Medical Cannabis Clinics, where she provides cannabinoid based medicines for those that are diagnosed with conditions which would benefit from such treatment. Specialising in anxiety, PTSD, OCD and birth trauma, Dr. Moore founded Make Birth Better, an organisation which draws on the knowledge of a collection of medical experts who use their first-hand experience and professional expertise to inform, support and improve the way birth trauma is experienced and interpreted. So, make sure and like and subscribe, and stick around until the end, so you don't miss out on the end of episode cartoon. Now then, let's talk cannabis. So, what led you to first get involved with psychiatry, and where did you first come across cannabinoid-based medicine?
Psychiatry-wise, was just a kind of gradual process of falling in love with it as I was doing my training and as a junior doctor, really. And I just really enjoyed it. Found it a really sort of collaborative discipline of medicine to be involved in, and probably a bit less hierarchical and just sort of full of lots of really interesting people who were really interested in medicine but also had lots and lots of other exciting things going on. So just really enjoyed it, and was really lucky to have some really amazing and inspirational consultants. And then with the cannabis side of things, I think, it's been on my radar for quite a while. It's something that I've always been interested in, potentially, because I suppose as a psychiatrist, I'm really keen that people should always have all the options and choices explained to them. And I think we know that a lot of the traditional medication we prescribe, we can't always understand why it works. We can't always explain that, and it doesn't always work for a lot of people. So I was really interested in it as, a really great option for people. And then because I do a lot of work specifically around trauma and PTSD, I'd sort of been following the early work coming out of the States mainly, on veterans and its use in trauma and reducing PTSD symptoms. And then I spent some time with a colleague who works there at Stanford, and, they were running trials as well. So it's just kind of grown over the last few years, really, and to the point where obviously I wanted to be a prescriber myself. And, I think cannabis alongside, now the psychedelics and other types of medications are potentially going to be a huge area of interest and research and prescribing in the next 5 to 20 years in the UK.
Just when you mentioned psychedelics, it is extremely exciting, the relatively unorthodox approach of medicine, the direction it's taken. I'm sure it's played no small part in the amount of people that use the substances recreationally and promote them as healthy substances. So, regarding cannabis medicine, do you have a general approach when you're first introducing a patient to cannabinoid-based medicine?
No, of course. So, I mean, clearly it's very new in the UK still. So, we are very careful and thorough and cautious about how we prescribe and who we prescribe to. So alongside any examination of somebody, you're wanting to know a really thorough, holistic history of who they are, where they are in their life, what their symptoms are, and what's brought them to thinking about this. Yeah. And clearly lots of people that come have been using cannabis for years and years and years, and the drive for them is that they want it to be on a legal prescription. Yeah. But then also you get a group of people that have never tried cannabis before and have had, trialed numerous other medications or therapies, and want to try this as something as a new type of treatment for them. Yeah. So it's very much always, for me, about hearing that patient's story and understanding why they've come to walk through the door of the clinic on that day. And then, exploring all the options and choices. Sometimes we will say, no, this is not the right thing for you. Right. But sometimes, it is absolutely revolutionary for people. And I think, there are issues still around cost for a lot of people. Yeah. And around, a consistent supply, because it is a very new thing. Yeah. Within the UK still. But, clearly that's getting better and better. you know, as we kind of get used to it and as services evolve. But really at the heart of it always is that person and, you know, their symptoms, their story, where they live, how they live, and how this might be useful for them.
You touched on it really well there, Rebecca, the fact that the level of subjectivity when it comes to cannabinoid-based medicine is that's one of the things where I think a lot of people become disenfranchised when they begin to self-medicate with CBD in particular, that they feel that it's not efficient, but it's largely to do with, it could be their diet, their BMI, even the dosage issue, all these different other variables, which adds to the complexity of it. I think when you mentioned that as well about the endocannabinoid system has somewhat of an extremely important role to do with trauma. And doing the research for the channel, the amygdala largely responsible for the fear centre of the brain, and one of the things that again, because of the limited amount of evidence that's available, it's again referred to as anecdotal, but because of the density of cannabinoid receptors in the limbic system in particular, the amygdala obviously central in that's the flooding of cannabinoids in that region is what removes the traumatic memories. And I have somewhat of a hypothesis, perhaps, maybe that's an evolutionary basis for survival, you know, because you can't really get on in life if you can't survive, if you can't move forward. And if you have these traumatic memories, they could have an extremely hindering action on how you are as a person. So, and the reason why I thought that was because it wasn't actually supplemented with cannabinoids. It was anandamide that was studied with this, which is, as you know, an endogenous cannabinoid. So the body has a framework for removing traumatic memories internally anyway, which could perhaps imply an evolutionary survival mechanism, you know, which is extremely exciting considering that we're now at the very, very early stages of understanding how this even works.
I mean, I agree. I think it's so exciting and it's so interesting. And I think, you know, yes, we don't have lots of scientific randomized controlled trials, but I think you only have to listen to stories of people with trauma to see how effective this can be. You know, I've got people that have had lifelong PTSD and trauma from, you know, terrible childhood experiences that within weeks have felt this profound shift in their symptoms. So there seems to be somehow this kind of shift in the way memory sits for people. So either, you know, nightmares, night terrors just sort of disappearing, or those memories seem to somehow be more bearable. So they might still be there, but there's something about them that just doesn't cause that huge amount of distress, or that the memories seem to be sort of disappearing. And actually some people have talked to me about positive memories then being able to come back, you know, maybe because there's then space, or just that they then start to remember things that are framed in a more positive way. So, you know, I've seen people where there's just been you know, regularly people will be saying to me, this feels, you know, miraculous or life-changing, or, you know, that's enabled people to come off multiple other medications and just be taking a cannabis oil or, excuse me, or vaping, you know. So just phenomenal to see and watch as a psychiatrist. It's, you know, it's really rewarding.
So, I mean, in your experience, how effective is cannabinoid medicine in treating depression? Because often we hear, how would you respond to those individuals? I mean, there are studies that have at least pointed in the direction of cannabis use relating to long-term depression, often omitting the fact that they're not analysing socioeconomic status and genetic susceptibility and all these different other factors. But in your experience, how effective is CBD in particular for depression?
Yeah, I mean, I think the evidence for CBD and depression per se is a bit more mixed. I mean, I think for anxiety, brilliant, amazing. So I think, you know, if you can bring down that level of overall arousal and anxiety, often mood will improve as a consequence of that, because you don't feel anxious all the time, you know, and you don't feel exhausted all the time. So of course your mood is going to improve. You know, I think for me, there is no reason why somebody cannot try CBD for depression. I think if you've got a mixture of anxiety and depression, then it probably works slightly better than if you've just got no anxiety at all. I think if you've got low mood or sort of chronic depression, then perhaps something that is more of, you know, has a higher THC content in it, I think can often be much more helpful for people. And I think that can help people with things like, you know, being able to focus, concentration, sharpness, and a lift of mood as well.
Right.
But I think, like all things, you know, if people are open to trying things, then, you know, why wouldn't you try these things? Because, you know, compared to perhaps, say, a traditional antidepressant that might take 2 to 4 weeks to work, and often for people has side effects that they just can't tolerate.
Yeah.
You know, I think the beauty of CBD and or medicinal cannabis is that actually hardly anybody has any side effects. So, you know, I think it's just another way to give people choice. I use antidepressants. I think at times they're needed and life-saving and work really, really well.
Mm-hmm.
But it just comes back to, again, being able to offer people more choice.
Yeah.
And that's always a good thing.
I mean, so in comparison to, I mean, you just briefly touched on it there for anxiety. There are a lot of viewers that will be watching and wondering if they have anxiety. It's a relatively generic term almost that has a very arms and legs attached to it essentially. So could you give a brief description of what anxiety is and how cannabinoid medicine fares compared to pharmaceutical intervention?
Yeah, I mean, I think the issue, you're right, anxiety is just sort of this widely used term, and actually for those experiencing it, there is, of course, a huge spectrum.
Yeah.
So I think, you know, we can all feel stressed and we can understand stress as something that happens to us.
Yeah.
But the thing with stress is it tends to be a more sort of temporary response, you know, perhaps to a deadline or something difficult happening. With anxiety, it's more of a clinical diagnosis. So it's where you just feel profoundly agitated, restless, on edge, overthinking persistently all the time. And then it can affect, you know, sleeping, eating. You might be having panic attacks as well. There might be social anxiety where you're worried about going outside. So it's very different from us all experiencing life's day-to-day stresses and a clinical anxiety. You know, anxiety is really, really common. I think at the moment, a lot of people are feeling very, very anxious.
Yeah.
Again, due to all the uncertainties of the times we're living in.
Yeah, of course.
And, you know, definitely there is a massive role for me in, you know, CBD can work really beautifully with anxiety. It can really help reduce that level of arousal and just feeling on edge and feeling unable to switch off and relax. I think, you know, as you touched on, the difficulty with CBD is that all CBD is not equal.
Yeah.
So, you know, what you might be able to buy from your newsagents or in Boots is not necessarily going to be anything like a CBD that I might prescribe to you. Yeah. And I think it's about trying to, you know, it's always about finding out with people what they've tried, you know, how they've found it, because there are so many, you know, CBD has kind of flooded onto the market and it seems to be pretty much everywhere, doesn't it? It's in face creams and, you know, everything you can think of. But, you know, the actual medicinal grade CBD oil is very, very different to something that you're going to buy over the counter in terms of quality, strength. And again, you know, I've had people that have been anxious lifelong that have found CBD at the proper dose and taken correctly has just been life-changing for them. So I think it's definitely, you know, it's a really good option, particularly with anxiety for people. And often it also has a knock-on effect on other things. So a lot of people might have overlapping pain or irritable bowel, or, you know, it can actually target lots of different symptoms at the same time. Yeah. So, you know, it can be really, really helpful.
It's really good you say that as well, like the have irritable bowel syndrome, because one of the things when I was writing my book, it has endocannabinoid system deficiency, and which obviously it clearly articulates that there is a correlation between things like IBS, fibromyalgia, migraines, and other non-localized issues. And one of these things that I was thinking was, there is a potential that mental health could fall under the bracket of that, because they don't really have a definitive answer, obviously, because we're still early doors, for the reason why it has such a diverse impact. And mental health, I think, because we're looking at the brain perhaps as a whole, or like particular organs, the bowel, all these different things, that it becomes difficult then to allocate it under the same umbrella. Do you think it'd be? Do you think it's feasible that that's the reality, that the mental health is as Professor Mike Barnes really articulated well in the interview, that the endocrine system is the master controller.
So you know, that's why there's so much interest in the gut-brain axis, and you know, some people would say actually it's the gut controlling the brain, not the brain controlling the gut. You know, and I think that's why there's been an explosion of interest in that. And you know, if you look at these kind of these diagnoses like irritable bowel or fibromyalgia, or you know, that there is such a huge overlap between the mental health aspect and the physical health aspect, and that you will often get improvements in both with using medicinal cannabis. You know, and you look at, you know, the role of probiotics, say, and looking at how that might, you know, interplay between gut health and brain health. So I think that's for me is a really interesting way of thinking that is going to run alongside our development and understanding of the endocannabinoid system as well. And I think also there's another sort of great focus in inflammation as potentially being the cause for depression, whether it's actually an inflammatory disorder. And again, that then can tie back to gut health. And so I think, you know, we know so little about this. And I think that's really exciting, because part of the reason I find it so exciting is because I want us to move away from this distinction of mind and body as being two different things, because we're not just a brain and we're not just a lung or a heart, or you know, we are a whole unique ecosystem. And I think anything like this that promotes the idea that actually you need to look at somebody, just let's be revolutionary and just look at somebody as a human rather than, you know, a mind or a stomach, or, you know, I think anything that speaks to that is really, really good, because we can't just look at one thing in isolation. We're more than just a symptom of low mood. You know, we need to know everything that's going on for that person. So, you know, I think that's really good, because that is bringing that into the framework of we need to look at all these different things. And you know, there is so much research going on to that I think it's a massively exciting time to be a psychiatrist, because there's just all these new avenues to explore and think about.
It is extremely exciting. When you mentioned that there about the compartmentalisation of like, look at somebody as a lung or an intestine or something like that, it's interesting, because even it's relatively disregarded in Western medicine, but Ayurvedic medicine does that. You know, it analyses the individual as a whole, and they look at their mind and body connection. I was watching a TED talk just this weekend. The woman, I can't remember her name, but she articulates really well that there are numerous instances of individuals who have cancer of various degrees, and they get given a placebo, but they get told it's the cure-all, and then 3 weeks later they go into regression, and the cancer that shrinks, and then after being informed that it was just a placebo, the cancer returns. And this is counter-intuitive to what Western medicine would promote, because it doesn't conform to the methodology of how things interact, this onto this and into this, which is extremely interesting. I'd also point out there's a relatively elephant in the room here, Rebecca. We're talking about mental health and cannabis promoting it, and we've spent the last 70 years on the other end. You know. It's like...
I mean, I think, you know, of course there is a population of people that
sensitive, of course,
cannabis is not going to be good for their mental health, but really we're talking about skunk. We're talking about them smoking skunk, which is not anything comparable to medicinal cannabis in an oil or a flower. You know, I've seen that firsthand, how damaging that can be to young people when they're using smoking heavily. And there is absolutely no question that it can, you know, there is a group of people who are vulnerable to that, and that it worsens their psychosis or prolongs their psychosis. But at the same time, I think what happened really is that, you know, this link was proven, talked about, but actually what nobody was talking about was the percentage of people that would be vulnerable or affected by that. So, you know, I live in South London, where there is a lot of cannabis use, you know, recreational, and the vast majority of people are using cannabis and they are not ending up psychotic in sectioned, detained in hospital.
Mm-hmm.
So yes, of course, there are vulnerabilities, and there are people that you would not want to prescribe to if they have a family history of psychosis, or they've been psychotic, or they are psychotic. Still, of course, that's just good medicine.
Mm-hmm.
But I think what we miss there was so much focus given to that connection, but what was missed in that was that actually the vast majority of people do use cannabis and do not become psychotic, So I think we have to hold that in our mind as well, and also hold in our mind that, we're talking about skunk, and clearly we're not prescribing, skunk to people, and any prescribing is done very, very carefully. So I think, it like anything else, it's a spectrum. Most people will be able to use these products and have no psychosis, no psychotic symptoms. There will always be a tiny proportion that can't use this safely. Like where you look at any other drug and the range of side effects, there will be common side effects and rarer side effects.
I like to use the example of epilepsy, for instance. So you have got people who are sensitive to epilepsy, therefore they're sensitive to flashing lights in movies. And it doesn't stop movie producers from making these films. All it does is they put a disclaimer to prevent these individuals from being sensitive to it.
And I think also, it's the cost at the moment obviously is still quite high for people to, a lot of people are very interested in this as something for their mental health. But people who have had long-term mental health issues of any kind, are less likely to be employed overall, so often have less financial resource, and it is prohibitive for people, because with the best will in the world, if you're asking somebody to spend £200 to £400 a month, if not more, it's too much for most people. So I really hope that pricing will come down, and that will make it more accessible for people as well.
It's certainly one of the exciting things that should be arriving hopefully in the next year or two, which I'm really looking forward to, because I do have friends who have parents who are in positions where they have to acquire it through back channels because of the cost. It's too great. I mean, I have a friend whose mum has Parkinson's in particular, and the difference in which she is prior to consuming cannabis, afterwards, it's two different people. Completely two different people. And this is one of the frustrating things, because we're sitting watching this with no availability, and it's like, this is medicine. This is unfortunate that this is, to say the least.
I mean, new things in medicine are always viewed with a little bit of suspicion, I think, and it takes people that are really passionate about it to kind of go for it and do it and build a case for it. And I think, medicine has probably moved too far away from listening to patients' stories and somehow seeing that as anecdotal, whereas to me, actually, that's the most powerful evidence you can have, because people know what works for them and they know their own bodies and their own health. But actually, because we haven't got randomized controlled trials, it's seen as, something that is not yet evidenced. Whereas I think we would be better to, of course, we need randomized controlled trials, but I think to neglect the stories of thousands of people who've used this for hundreds of years and found it effective is not the right thing either.
Yeah, the randomised controlled trials in particular are difficult, because, as we've mentioned, the level of variability relating to cannabis is so vast. It makes it immediately difficult, because randomised controlled trials, as you know, is an isolated molecule that's conforming to that, which makes it extremely difficult. Personally, Rebecca, what do you think is the most exciting aspect about cannabis, cannabinoid medicine and psychiatry?
I mean, I think for me, again, it just goes back to, particularly the people that I've prescribed that have trauma or PTSD.
Right.
I think it's just been, it's been massively rewarding. You've got people that have been so disabled by their distress and symptoms that suddenly are feeling just haven't got that level of distress and torment going on, that then means they're able to reduce the amount of medications they're taking, that they're more able to feel like they're living their life. Their quality of life is just so much improved, that I just think that is, as a clinician, that's just absolutely lovely to watch.
Yeah, I mean, we touched on it a minute ago there, but I was going to say, do you think randomised controlled trials with a strong inclusion of observational trials, do you think this is the recipe that's required?
Yeah, I mean, I think it's got to be, like you say, it's going to be very, very difficult to do sort of classical randomized control trials. So I think we have to, I think we need a mixture of sort of qualitative and quantitative research and, more observational trials. If you think at the way that they're managing to produce data already about, say, MDMA assisted psychotherapy or psilocybins, they are managing to start to produce really good data.
Yeah.
So, they have shown us that this is possible in this field. And I think we're doing people a real disservice if we don't try to collect that data. And obviously things like, Project 21 is going to really help, because that's going to capture data about lots and lots of people that are using cannabis for lots of different reasons. And, we're going to have actual standardized measures and outcomes. So that is also going to be really, really helpful. So I think we can get there. But I think, it's probably like most things in medicine, it's going to take a while. It's going to take longer than we would want for people. But I think we will get there. And, I really hope that this will come onto the NHS formulary long term, but I don't see that that's going to happen particularly quickly.
Yeah, it certainly seems like normalisation seems like key in order to promote cannabis as a legitimate medicine. I mean, I broke my finger a couple of months ago, and I was in the waiting room, and there was a couple of nurses in, and I was talking to them, and I was telling them about the channel, and I'd asked them, there was 3 nurses there, and I asked all 3 of them, do you know what an endocannabinoid system is? And all of them said no. And that's extremely disconcerting, because I'm in a medical establishment who you put your safety into these people, and it's by no means their fault. It's just reflective of the undereducation because of the lack of information. So do you think that's a key? I mean, the Centre for Medicinal Cannabis Clinics in particular, they do a good job of this, of educating practitioners. I mean, do you think this is really key in order to normalise?
I think it's completely key. I think it's about, showing that it's carefully thought out, well organized, evidence treatment, and that this is not people just sort of randomly prescribing cannabis to people. I think, we've got a lot of work to do to break down the stigma and fear about prescribing, often from other medical colleagues. And also I hope that, it will kind of filter through into training of students as well. I mean, medical students, I doubt many get any training on this at all. So I really hope that it will become something that is just much more widely discussed and thought of. And there is a lot of fear about prescribing. I've had lots of people say to me, that they wouldn't do it, they wouldn't prescribe, why are you doing it? You're going to get struck off.
Yeah.
There is a lot of fear and stigma around this for professionals as well as patients. So, I think the more that we can have these kind of discussions and allow people to ask questions, the better. And that's certainly, something as part of the MCCS that, we're trying to do lots of teaching and training and provide really good guides and support around how to use CBD, for example, so that people can see that this is something that's really carefully thought through. And most patients with cannabis products are hugely well informed. I find much more informed than with other medications they've often been using for many years. They know what works for them, they know how to take it, they're very responsible. They're often massively informed. And I find, often have a level of understanding and awareness far greater than, if you were to say prescribe them an antidepressant. So it's interesting because the level of patient knowledge from, in this group is much higher, I'd say.
Well, it's really actually unprecedented if you think about it that way. I don't think there'll be another time where this happens, where the patient's like, excuse me, I'll correct you there. I don't think that's going to happen again.
No, exactly. Like, so, often I feel that they know far more than I do. And that's great because, I'm so happy to learn from them and to, understand, how they use it and how it's worked for them. That's how medicine should be. It shouldn't be about me telling somebody what to do. It should be a collaborative treatment together.
Yeah. One of the interesting things I find it quite humorous is like as a teenager, it was at the beginning you use it recreationally, relatively like a rebellion almost kind of thing. And I find it quite humorous. It's like you fast forward 20 odd years and the substance that you're getting told is bad for you is actually really healthy for your body. You're like, what a stroke of luck.
I know. It's interesting. It's an interesting trajectory for people where, you know, often they'll say, oh, I smoked a bit when I was younger, and but now they're coming back to you sort of wanting it on prescription.
So before we get going, Rebecca, what do you think is the most exciting thing? Well, before we get going, what do you think the future has in store for cannabis-based medicine and psychiatry?
I mean, I think it will just become something that is seen as, I hope it will be seen as something that is a mainstream treatment that is comparable in safety and efficacy to some of the other more traditional pharmacological choices. You know, I really would love to see it as something that's offered to a lot more people, because I think it is a good option and choice. I would really love to see the price come down for people, because I think it's, you know, a big financial burden for people. And, you know, I'd like to have more data to be able to support me prescribing and be able to show to people as, look, this is why, you know, it can be so helpful for you. Really, it's about, like we've said, that sort of normalization of it. I don't want it to be seen as some kind of alternative and odd choice. I really want it to be just a standard choice for people alongside all the other medications we prescribe at the moment.
So, I mean, do you see any apparent hurdles that are kind of getting in the way of that?
You know, I think there have been hurdles, obviously. You know, there's often been issues with supply, with getting things into the UK, with cost again for people's, you know, perhaps GPs or other professionals not supporting them. And then that makes it very difficult for people to know what to do. You know, so I think all of those things are still evolving and will get better. But, you know, I think the main issue for people at the moment does often come down to cost, because it's, you know, it's potentially a big amount of somebody's money to spend. You know, I would always try and argue that it's worth it in terms of health and what it brings for people, but you know, the reality is it can be a big chunk of money for people to find.
Definitely. I mean, one of the things I kind of use in my mind where to resolve the issue for the price is you're not just paying for the medicine, you're paying for the consultation, you're paying for the expertise, you're paying for the constant monitoring of your situation, which would be absent if you were to just go to the shop and buy the same substance.
Yeah, and I think, you know, when it feels effective and you get that change in the quality of your life, then of course that's worth more than, you know, you can quantify in financial terms for people. So, you know, I think most people that see that amazing response will find a way to pay for it as an ongoing treatment. But, you know, I wish for people that, you know, it was something that they were paying a standard prescription charge for, of course, you know, because it's a huge amount of money for people.
Well, thanks for chatting with Rebecca. Would you have anything you'd like to add before we get going?
No, I mean, I just think, you know, it's really great that we're having all these conversations, and I hope, you know, it shows to people that it's being done in a really thoughtful and measured and considered way. But, you know, just, gosh, I've been prescribing for about 6 months now, and the amount of people I see where it's had absolutely miraculous, life-changing effects is just so amazingly wonderful to work with. That, you know, that makes me even more convinced that this is something that I want to be a part of. And, you know, I think that it will only get better and better and more sophisticated for people with time.
It's certainly an encouraging time, Rebecca. Well, thank you very much for your time, Rebecca. I've really enjoyed this.
Oh, no, thank you. It's been great.
Thanks to Rebecca for giving me her time, and thanks to you for sticking around until the end of the video. I sincerely hope you enjoyed the content. I'll see you next time.